If you're looking for senior care, you already know just how overwhelming it can all feel. But what if one of the best options out there is one you've never even heard of? Today, we're going to look past the usual suspects to find what might just be the perfect fit for your family. Look, if you've ever been in this spot, you know it's just a really emotional and confusing process. You're trying to figure out complex needs, you're looking at the finances, and you're learning a whole new vocabulary. It's a journey so many of us are going to take. And when you start that search, one name just pops up everywhere, right? Assisted living. It's what you see in all the brochures, and it's what we tend to think of first. You know, those big communities with apartments and lots of activities. But is that the only choice? So, just how overlooked is this other option? Well, according to Genworth Financial, a huge 30% of families who are exploring senior living, they aren't even aware that residential care homes exist. I mean, think about that. That's nearly a third of people who might be missing out on the perfect solution.
So let's pull back the curtain on this overlooked option.
First things first, what in the world is a residential care home anyway? A residential care home is, well, pretty much exactly what it sounds like, a home. It's usually a private house in a totally normal neighborhood that's been specially set up to care for a small group of seniors, often just 6 or even fewer. This isn't some giant complex. It's a house, and it's designed to feel like one. And right there, that's the key difference. On one side, you've got this really intimate care home with just a handful of residents, which means the attention can be super personalized. And on the other side, you have the big assisted living facility, which is more like a community campus with apartments and a real focus on amenities and lots of activities. They're just two very different worlds for two very different types of people.
So what does that smaller setting actually mean for day-to-day life and the kind of care someone gets?
This is a really crucial point. Think of a spectrum of care. These homes often provide a higher level of personal care than you'd find in most assisted living places. But they stop short of the round-the-clock intensive medical care you'd get in a skilled nursing facility. They fill this really important gap right in the middle. So inside the home, residents get help with what's often called activities of daily living. We're talking about the essentials: a private or semi-private room, home-cooked meals, and real hands-on help with personal care like bathing, getting dressed, and making sure medications are taken on time. It's all about providing that support in a familiar, comfortable place. But you know, it's just as important to understand what a care home is not. They're not clinics, so really complex medical stuff like tube feeding or treating advanced wounds, that's typically not what they do. And because they're so small and homey, you're not going to find that long list of recreational activities like, say, a swimming pool or a movie theater that the bigger places often have. Okay, let's talk about the elephant in the room for any family. And that is, of course, the cost. Let's break down what the financial picture looks like. According to Genworth, the national average is sitting at about $5,900 a month, which is actually pretty comparable to assisted living. But, and this is a big but, remember, that's just an average. The actual cost is going to swing a lot depending on where the home is located and the specific level of care your loved one really needs. So, how do people actually pay for it? And listen up, because this part is a really critical distinction. Most care homes will accept private pay, long-term care insurance, or benefits for veterans. But what they typically do not accept is Medicare or Medicaid. And that is a huge piece of the puzzle you have to know for financial planning. So with all that in mind, the real question becomes, who is this for? Who is the kind of person that really thrives in this kind of environment? First, just think about your loved one's personality. For a senior who finds those big, bustling, sometimes chaotic environments a little overwhelming or too institutional, the quiet, home-like vibe of a care home can be, well, a huge relief. At the end of the day, it's a fantastic option for someone who can't live on their own anymore, but who would really hate feeling like they're in a big institution. It's for the person who still wants to feel like they're in a real home, a place where they can have visitors pop by anytime. And what about consistency? Think about it. In a really big facility, the staff can change all the time. But in a small care home, your loved one is probably going to see the same few caregivers every single day. And that allows for these really deep, trusting relationships to form. Now, for residents who have Alzheimer's or dementia, this consistency can be an absolute game changer. Those familiar faces, that predictable, calm environment, it can dramatically reduce their anxiety and stress. And that makes a world of difference in their quality of life. So it kind of leaves us with this one last thought. When we're choosing care, it's so easy to get lost in all the checklists of services and amenities. But what if the most important feature isn't on any list? What if, for the person you love, the right size isn't just a small detail? What if it's the entire answer?